All right, welcome back, everybody. This is our second live stream of the day. MAB, our Medical Aesthetics Bazaar, officially started today. We have 5 days of amazing specials on our most popular treatments and, of course, products. So you're definitely not going to want to miss that. These live streams are really for you to talk about some of those treatments, to answer some of your questions, provide you some more context for what we do. And of course, exciting giveaways. So right now, I'm going to bring on Dr. Chahal. He's an oculofacial plastic surgeon that we are blessed to have as part of our office. And he is going to talk about surgical versus non-surgical. So some of the common cosmetic concerns that people might have and how those may be addressed surgically or non-surgically. He is the expert in that field, and he's going to have a lot of great information for you. Obviously, there's also a giveaway at the end of the session. We're giving away 30 units of Dysport. So if you'd like to be entered for a chance to win, go ahead and write your name in the comments, and then make sure to stick around to the end of the session, and that's when we're going to pick the winner, so you can find out if you won. If you're not able to comment for some reason, you can also send us a quick email, info@empireeyeandlaser.com. Let us know you'd like to be entered into the drawing for this session. Same thing if you're watching on Instagram, you have a little bit more of a behind-the-scenes view, and you're going to be able to either put your name in the comments and we'll add you into the drawing, or just go ahead and send us an email, info@empireeyeandlaser.com. And of course, any questions that you have, please go ahead and put those in the comments so Dr. Chahal can address that for you when we get to the questions portion of his presentation. So without further ado, I'm going to go ahead and hand it over to Dr. Chahal. Dr. Chahal, welcome so much. Thank you.
Thank you. Hello, everyone. So today I'd like to just briefly go over surgical versus non-surgical facial rejuvenation. I think in today's age, there's just so many treatment options that it often becomes confusing, not just for you all, but sometimes for providers as well, to keep on top of all the different various treatment options we have. So this will be a very brief overview of kind of what the main types of treatments we have for facial aging are. So to start with, I wanted to talk about just the structural components of the face itself. So I wanted to talk about the face in 3 layers: the structural beams or support of the face, which is the bone, your bony skeleton; the in-between layer, which is almost like insulation. So this is going to be your muscle and your fat predominantly. And then the superficial layer of your skin, which is the exterior envelope that binds everything together. And if you look at this split face photograph between the left side and the right side, you're going to see changes in all 3 layers of this person's face. So for example, here you have some recession of the bone of the forehead, which really results in dropping of the eyebrow. Gravity's also doing the same thing. Some sagging of the skin here, volume loss in the tear trough region, descent of the cheek, more volume loss here in what we call the nasolabial fold. So these are all changes that occur in all 3 layers. And so the various treatment options we have, both surgical and non-surgical, are going to try to address one or all of these structural elements. Okay, so facial aging, of course, occurs on a spectrum. The number one factor of determining where you are on the spectrum, of course, is age, but age is not the only thing. Just because you're, say, 65 doesn't mean you're going to have terrible signs of aging, and just because you're 30 doesn't mean you won't as well. So there's other factors as well. And what are those other factors? Well, number one, your general health. Are you diabetic? Do you have a history of smoking? What's your relationship with alcohol look like? Genetic factors. Are you light-skinned? Are you dark-skinned? Do you have a lot of cumulative skin UV exposure? That will massively affect how your skin looks. Again, UV damage over time. And then this is sort of another split face example of similar. So this is the same patient 30 years later, the more age side, of course, on the left. And you can see actually not too bad in terms of aging changes, but the typical changes we always see. You're going to see some descent of the soft tissues, so the cheeks are lower, some jowling, some loss of volume in her cheeks and in her temples, and then sagging of the skin, sort of gravity changes, if you will. So what are some of the non-surgical treatments we have? Well, they basically come down to 3 categories. There's the injectables, skin treatments, and then non-surgical lifting. So the first category is going to be what you know as neuromodulators, so that's your Dysport, your Botox, Jeuveau, and then your filler categories, the Restylans, the Juvederms, those types of products. And these injectables are designed to address movement of muscles or volume loss in your face. The second major category is going to be any kind of superficial skin treatment, whether that's a chemical peel, whether that's a laser resurfacing, or some type of IPL or BBL treatment. And those are basically broad-based light to try to rejuvenate your skin just using light alone. And non-surgical lifting is going to be thread lifting, energy devices like ultrasound and radio frequency that try to tighten skin without us surgically having to remove any. So what I'd like to do next is just show you a few examples of what those common treatment options look like and who they apply to. So this is the same patient. On the left side, you see this patient smiling. And when she smiles, the muscle around her eye is creating these lines along the side of her eye. We call these crow's feet. So this is due to the contraction of the orbicularis muscle, which helps you close your eye when you blink. Now, if we put neuromodulators in here, so Dysport or Botox, that will relax these muscles and prevent them from contracting. Here's the same patient smiling again, and here you don't see any contraction of those muscles. So just by using an injectable, Botox or Dysport or any of the medicines in that category, we can dramatically reduce the number of lines that appear when you move the muscles of your face. That's very different than what a filler is. So a filler is adding air to the tire, so to speak. So if you look at the patient, this is the same patient left and right, and if you look right here in her tear trough region, that's the region between her eyelid and her cheek, you can see it looks a little sunken in here, and almost a shadowing effect that occurs when you take photos. And if we could just inject something in here underneath her skin to project her skin upward, to take that trough, take that valley and lift it up a little bit, this is what it looks like on the right afterwards. So this is less than a single syringe of filler. And basically, I've just tried to make that contour from her eyelid to her cheek a smooth, continuous one without a valley there. And that's adding air to the tire, so to speak. So this is sort of a common indication of filler. So generally speaking, your neurotoxins are going to be in the upper half of your face, whereas filler can really be used all over the face as needed to fill volume loss. Let's talk a little bit about skin treatments and what's kind of possible. So this is a patient who has a fair amount of redness against her white skin, especially in the cheek area. This happens for a variety of reasons. This can happen from acne, this can happen from rosacea, this can happen just from UV exposure. But you can actually do a lot to treat someone's skin without actually having to remove anything at all. So this patient actually underwent a series of BBL treatments and chemical peels, and you can see just after, I think in her case, 3 rounds of treatment, she has marked improvement of that redness in her face. And even the browns, if you look really closely in between these red spots, you'll see some hyperpigmentation as well. And that's just from UV exposure, or sunspots as we call them. And those are very readily treatable these days with energy-based treatments or superficial peels. And if she had more severe damage, I would have said laser resurfacing. So there's many treatment options, and they, again, are on a spectrum of severity. I don't have an example here of non-surgical lifting, but thread lifting and energy lifting are devices we can use to sort of tighten your skin and lift it, provided you don't need too much of a lift. Okay, so when are non-surgical treatment options, the options we just discussed, better than surgical options? Well, number one, if your changes are only mild to moderate, say patients on average in the less than 50 group, mild to moderate skin jowling, mild to moderate volume loss, patients who desire less downtime, maybe you want something that can help you, but you have a big event coming up and you can't afford to take a week off work or be very bruised or swollen. You're okay with repeat treatments. Typically, non-surgical treatments are going to be more iterative. That is, you need multiple treatments to get you to your desired result, and so you have to be okay with that process. It's a longer timeline. Perhaps you have medical issues that make surgery undesirable. Maybe you're on immunosuppression medications, maybe you have a history of smoking and you're not able to quit. Those issues might make you not the best surgical candidate. So that's something we would discuss on a patient-to-patient basis. But in those cases, sometimes it's better to try non-surgical treatment options first. And then lastly, there's of course financial considerations. In general, an individual non-surgical treatment is going to be cheaper than surgery. However, if you end up having multiple surgical treatments or you think you're going to need many non-surgical treatments, sometimes the cost is a wash, and surgery might even be the more fiscally responsible option. So those are things that we would decide after meeting you and assessing your individual situation. When is surgery a better option? Well, basically the opposite of the scenario we just discussed. So if you have anything more than moderate sagging skin, jowling, volume loss, If you desire significant facial reshaping, if we need to kind of change the shape of your bones a little bit, if we need to move areas of volume in a more significant way than would be financially viable with fillers. If you desire a longer term solution, in general, if we can surgically move something, gravity is still going to move things over time, but generally you're talking about an 8 to 10 year surgical result duration for most patients. And if you prefer to only go through treatment once, if you'd rather have everything done all at once and just deal with a week or so of downtime and just be done with it, then you might be a better option for surgery as well. Okay, so let's look at some individual options where we might have done one versus the other or combined treatments. So in this case, you're seeing an individual here with very droopy eyelids and eyebrows. So this is not a situation where any amount of injecting anything or pulling with a thread is going to give him an adequate repositioning of his upper brow or his eyelid. So this is a case where surgical lifting of his eyelid and eyebrow is actually what is needed. Now, could you have done more conservatively to rejuvenate this patient's skin? Of course. Could we have added volume here? Absolutely. But if your main issue is descent of skin and droopiness, sometimes the best option is going to be surgical. Let's look at another option here. This is a patient who was concerned primarily, again, about sagging skin in her upper eyelid and also about this bulging fat here in her lower eyelid. And so all she wanted us to do was remove a little bit of skin from the upper eyelid and just get that bulge a little bit flatter. Again, we don't have any good non-surgical options to address those particular concerns. And so in this case, she had to have surgery to do that. Let's look at lip lifting. So these days, using fillers for reshaping a patient's lip is very common. We do it all the time. But what can a lip lift do that fillers cannot do? So if you look at this patient on the left, it might look like she has a very thin upper lip. In fact, what she has is a very long upper lip. If you look at the distance between the base of her nose all the way down to the red lip here, this is actually an abnormally long distance. And the only way to actually get her lip to flip out in this case is not to add more volume to her lips, but actually to remove a little bit of this tissue here. And you can see the scar is placed just here beneath the nose, and so she's still healing, but the lip has been flipped out and we've effectively shortened this distance. So it looks like she had the volume added or maybe filler to her lips, but she has not. We've just simply removed some tissue to flip the lip outwards. And then this is what it looks like when you try to address multiple areas and combine both surgical and non-surgical elements at the same time. So I'm using this kind of as a very stark example of the power of combining various treatments. So if you look at this patient on the left, you can see she has a fair bit of brow hooding here and descent of her brows. You can see tear trough volume loss here. You can see descent and deflation of her cheek, which has resulted in this creation of a nasolabial line. And what these lines here on the mouth are called marionette lines. And gravity has produced a little bit of a jowling effect here, which has blunted the angle of her jaw. And her chin is a little bit on the small side too. So if you combine surgical and non-surgical treatments, you can get this pretty impressive outcome on the right side. So what was done for this patient? Well, she had her brows lifted, she had a little bit of skin removed from her upper eyelid, a little bit of fat removed from the lower eyelid, and then a bunch of volume added back in. So she's had filler in her cheeks and along the side of her face here. She's had some filler placed in her tear troughs. Surgically, the whole bottom part of her face was lifted. That's what gave her this nice crisp angle here on the jaw. And then the entire surface of her skin was resurfaced with a laser. So we've really refreshed the surface of her skin as well. So again, we've kind of addressed all three layers of her face to give her this comprehensive result. Obviously, this is a much more involved procedure, more downtime, but the results, as you can see, can be pretty dramatic. So these are general principles about how I think about addressing patients surgically or non-surgically, and every patient's different, and what your treatment goals are will dictate what the best course of action is. With that, we'll turn it over to Alex and any questions that you all might have. We'll go from there.
Do you have a favorite combination of surgical or non-surgical treatments that you personally enjoy performing?
Yeah, I think for me, any amount of brow lifting, eyelid surgery, lower face lifting, and then some combination of fat grafting and laser resurfacing, again, trying to address all three layers if possible on the surgical side, I find pretty satisfying. On the non-surgical side, I really think the energy-based treatments like BBL and laser resurfacing and even chemical peeling is something I'm a big fan of, because I think those are really effective treatments that can really do wonders for people's skin. And if we can at least start with someone's skin, the outermost envelope, and then work our way inwards, oftentimes that'll really refresh how a patient looks and feels.
All right, well, thank you so much. Currently, it doesn't look like we have any more questions. Thank you so much, Dr. Chahal, for your time for talking about this topic for us all. It looks like we are ready to go ahead and draw the winner of our 30 units of Dysport that we're giving away. So everybody stand by for that. I'm going to add one more name here. All right. All right, here we go. We're going to go ahead and draw the winner. I'm going to bring up our wheel of names.